Morning, my skin classic enthusiasts. I know I'm just a couple minutes early, but I wanted to hop on here and let you all know that I'll be doing a giveaway. And also, you can expect this entire slideshow in the comments below. So you'll be able to capture that and everything that's in this training today. So if you're somebody that has some difficulty looking at syringoma, maybe a client comes in and they say, look, I have all these milia. Could you treat them? Or what are these yellow bumps under my eye? And you think that maybe it's milia, maybe it's cholesterol deposits. You don't know. Well, it's very common to misrecognize syringoma, especially if you've never had it explained to you. Just like me, way back in the day, I didn't know what it was. I thought it was milia too. So I'm here to tell you that it's okay. I got you covered. I'm going to have you treating syringoma like a ninja by the end of the training session. So if you're out there, let me see a raise of hands where you're watching from and who you are. And if you have a question, please pop it up in the comments because I'm here to answer them and show you great video. I'm going to show you some things not to do and all the outcomes that you can expect. So, oh, hey, Sue and Jerry. And oh my gosh, you guys, there's a lot of you hopping on. Hudson, Florida. That's pretty cool. Yay. Okay. Okay, so let me get started because our time is valuable. I know if it's Monday and you're off for the holiday. So Syringoma, they're the uninvited guests on my client's skin. It sure is something that plagues them, and I just got off alive calling this a really pesky irregularity. All of our irregularities are pesky, whether it's skin tags, brown spots, broken capillaries, cherry angiomas. We don't really like them, but this is even more pesky because this pesky irregularity seems to keep popping up in about 8 to 10 months after treatment. Let me explain with my slideshow here. A syringoma is a firm bump, or they look like kind of soft pillows on your skin. There's nothing in them. They can form in little clusters, which makes them even look bigger. And it's a result of overgrowth of the sweat glands. And they're harmless, they're nothing to worry about. But obviously, we're in the cosmetic business. We want our clients to feel good about themselves by looking better. There are ways to treat syringoma other than the Skin Classic. I'm just going to go over a couple of them here. Some would put a little bit of trichloric acid on them, like individually. That can be a little messy and it can also injure the skin around it. Remember, these things are very tiny. Some of them are larger, so you may affect the skin around them. Surgery is the one and only really way to remove these. The derms can actually cut them out, stitch up the skin, gone forever. But when it comes to syringoma, there can be so many of them, and that's usually not the course my clients want to take. Laser removal, which again wouldn't be as permanent as surgery. You could do electrocauterization. That's the machine that would actually zap, zzz, zzz. You would see the smoke form and it would cause a burn to the skin, and that would quell them for a while, but it probably would not kill it down in the dermis where that sweat gland is. And if you really were cranking up that electrocautery, you could damage the skin. So there's a real fine line there. You could cryotherapy those, but again, around the eye might not be the choice therapy. And again, you'll also injure the surrounding skin as well. Dermabrasion, awfully rough on the skin. And so our clients want something that is more tailored to their lifestyle. They don't have to be down for weeks with stitches or really not looking good. So I say that electrodesiccation, the Skin Classic, is the perfect treatment for clients. But now we want to differentiate what milia is and also what it is that really makes syringoma look different. Now, here we have some milia. Milia is that trapped keratin, and we all know what that is, and we've seen a lot of it in our practices. So there's no denying what a milia looks like. But when you see a client with syringoma, it might confuse you because you didn't even know the term syringoma until maybe today, or maybe in our group, Thermolysis Skincare for Estheticians, or you were trained with the Skin Classic and you had someone actually have syringoma during your training. So we know what milia is. And you know what? Let me get out of this picture. There we go. That's better. And so this gets trapped under the skin, and there's ways we can go about treating this. Some people like to manually excise them with a lancet. I prefer the Skin Classic. There's different ways to do it. Even some peels might help your clients, right? But let's take a look at the syringoma versus the milia. So the syringoma, I always think it looks like little white flat pillows, just raised just a tiny bit. They're soft. The milia, on the other hand, are usually in a sphere. They're little hard bumps. You can actually see the sebum under the skin. So, this is a true difference. That's why this slideshow is going to be in the comments so you can pull it off and keep it so that you can, when the next client comes in, think about it. If they say they have milia, just think about maybe it could be syringoma. So you could see how these are soft, pretty much more bright white because there are no keratinized cells in there, no sebum, nothing to make them sort of yellowish. They're more whitish. And let me just see. Hey, good morning, Roland. How are you? Yay, everybody. Terrific, terrific. And if you have questions, make sure you pop them in the chat box. I'll get to it. So that's what it looks like next to milia. How about cholesterol deposits or xanthelasma? That's a tough one for me. So on the left, you see again those soft white pillows, and they're wider than some milia would be. Milia is usually, again, spheres, little hard bumps. Now look at the cholesterol deposits on the right. Look how yellow they are. So some syringoma will actually grow together and they may look longitudinal. Um, and that might be confusing for somebody saying that they might be cholesterol deposits or syringoma. And I have a client that I'll show you where the syringoma actually grew together and it looks like a cholesterol deposit. Uh, but hopefully that helps. Now, syringoma, again, same picture, but these are syringoma as well around skin of color. So it doesn't matter the Fitzpatrick that you'll be working on. This is a low power device that we're using. So it won't treat the skin as a burn where your client might hyper or hypo pigment. It will dehydrate it. So you'll see in our videos today how we actually go about treating these. Now, again, they're all soft, but on darker skin, they don't show up as white. So they may show up as the same color as the skin with no differentiation in that. So okay. So I don't know if you know this, but there are a lot of people that suffer with syringoma. So there's a Facebook group and it's called Syringoma Awareness. And this is where I've offered help to other people because there are so many of my talented skin classic providers out there that can help these clients because these clients are really desperate for a clearer complexion. And so if you go on Facebook, make sure you join this group, become active, learn a little bit more about how people are feeling about their syringoma, how maybe you can help them by joining in the conversation and perhaps getting someone in your chair that you can truly help. And that's a good group to get into. If you are a Skin Classic provider, then you are on our map here, which is on our website. When clients message me, they go to my website and they can find a Skin Classic provider. When the map is opened up, your listing pops up as well. And if you're in their area, they probably will give you a call for the Syringoma. And we're going to talk about some of the before and afters. Now, um, Syringoma, let me just say this first. When a client lets me know, maybe they let me know they have syringoma, usually they don't. They don't even know what it is. They usually think they have milia. So they'll come in, I will examine them, and I realize that they have syringoma. I let them know that it's a disorder of the sweat glands and it is a dermal irregularity. Now, in our practices, we're treating the epidermis. So, what you're seeing on this picture is the epidermal manifestation of what's happening at the basement level in the dermis. So, we're not able to affect the dermal layer with our machine, good thing, because we wouldn't be able to use it, but we can take out and flatten the syringoma. With that said, I must let my client know that they're going to get these back again, probably the same ones, but over time. They can enjoy months and months, maybe a year or so, with a smoother complexion, something that does not make them self conscious. And when they start to become more pronounced, they can simply come back to the office for another treatment. So, this picture here comes to us from Katie up in Vancouver. She's an awesome Skin Classic provider. And she treated this nice client actually from a referral from our website, and they contacted Katie. And Katie actually had to do, I think this was her second, before her second treatment. So you can see before, when she came back, she was healed, but she still had some residual. And that's perfectly normal, sometimes with any of the irregularities that we're working with. But this one in particular is a pesky one. So there's no denying that the client will probably need that second um, treatment. But look how much better it looks for that client. So Katie did a great job there. And I'm sorry that you can't hear me. I think everybody else is hearing me. So good with that, I think, right? Good. Okay. Good, good. Um, so let's move on here. So here's a nice client of mine, and you can see the syringoma, and you also can see where the syringoma sort of grew together. That might make you think it was a cholesterol deposit, but looking at all of the other syringoma that she had, even on her eyelids, would tell me it's all syringoma. So I'll show you some video on her, but let me just take you through her healing here. This was before she had anything done. This was a few days after the treatment. She sent me some selfies and she did a really good job. Um, they don't usually send them that great. But anyway, you could see that it's not that bad. There is a crust that forms, but it's not a black crust from like a cauterization because we dehydrate these. We don't burn them. So, for all of you Skin Classic providers, please, those words in our vocabulary should never exist because we don't burn. We really don't even zap anything. We're dehydrating them with an electrical current. So, let's see how she fared after treatment. Okay, a little blurry, but you can see the before the during, and then when she healed. And this picture is also clearer in our before and after book. So, this is a good picture to show your clients when they're contemplating a treatment with you and syringoma. Let them know this is how it looks before. Look what you'll look like in a couple of days, but you can expect really nice results. However, I can almost guarantee you will need that second treatment in a month to 6 weeks to flatten those out even more. And then in about a year, you may notice that a few of them are starting to rear their ugly heads again. So that might be the time your client will call you and say, they're coming back. Please don't overpromise this service for Syringoma because they will come back. You must be honest, and so your client won't act like, well, they didn't go away. They weren't supposed to completely go away because they can't. It's at the dermal level where all of this is happening, and you're seeing what's happening on the epidermis. So that's very important to explain to your client. Um, so let's take a look at how this is done. And this was the previous client. I'll go ahead and pop this on. Okie so I have Sherry in the chair. So let's see here. Now you all can hear me, right? Why I narrate through this. Give me a thumbs up if you can hear me. I'd love to know that. So I have my clients open their eyes because I work from behind the head generally. So I need to see close to the lash line. So that's why I just had her open her eye. So my hand is really well rested. And I did numb this client with Neuromed BLT. And you can see that I'm using the tapping motion. I have my machine set at 25. I'm using my F12 and I am tapping in rows. Now, I'm tapping somewhat light and generally I'll get what I need for the Skin Classic to work. You may see me in some other videos, maybe working a little slower and a little bit more deliberate, like the cholesterol deposits. I kind of lay on that a little heavier. These syringomas, I'm just a little bit lighter. So you can see a little bit of pressure onto the skin. And if you're not comfortable working around the eyes, start working with your stretch. You want to plant your fingers so that the skin doesn't move. The client feels like you've really got them weighed down. They feel more confident. And when your working hand with your Skin Classic probe is rested on their forehead, and you come down onto the skin instead of doing like this, you'll get more even touching of the skin. We have to have the hand like a fulcrum coming down onto the client. So you can see here, I have the skin pulled way down away from the eye so I can get right under those eyelashes. And she seems pretty comfortable. She's turning a little red. And here again, I have her open her eye so that I can get in there. Now, I'm used to working around the eye doing permanent eyeliner and such. So I'll go ahead and really manipulate this so I can get right in under those lashes. And it's not easy for everyone. Um, Sue, will you be able to watch this later? Yes, always available in replay right here on my page. So you can pop back in and you'll also be able to retrieve the slideshow too so that you can educate yourself and your client. So, okay, great. And with this, you don't see like a wow effect. When we treat a cherry angioma and poof, it's gone. This you won't see a change, just like treating flat hyperpigmentation. We generally don't see much of a change, but just know your foot's on the pedal, the client can feel it, you're touching, you're tapping, and so the current is flowing. Don't go back over them. thinking, oh, well, I wonder if I really got that. Be methodical, start from one end, the outside of the eye, moving in towards the inside of the eye. A little less sensitive out here than it is on the inside. So there is a method to the madness. So let's see here. I'll go on to the next. So this was maybe when she came back. I'll have to check. Nope, that was this video as well. It's just a double. Sorry. Let's go on. So you're probably wondering, what am I going to charge my client for this session, for this procedure? So generally, we charge $25 per irregularity. Well, you saw all of those syringomas. There were many of them, and she has two eyes, so she had pretty much double what was on each side. So that probably, if I counted them all up, there would have been at least 30 of them that I was treating, and I wouldn't want to do 30 times 25. So I'll bundle a treatment like that. And you can see it is fairly quick. So each eye may take 5 to 8 minutes. So I don't want to gouge my client, but I know that my service is worth it. I probably, for what you just saw, charge $300. Then what I do is I'll invite the client back in for a additional treatment. Now, with Syringoma, I do charge a little bit more than that $25 for the second treatment. Normally, things we do are permanently gone, but Syringoma is a pesky one. So I'll generally charge an additional $100 to do that second treatment. And that's the only one that I play around with, that $25 flat fee for the second treatment that I normally do. And that just helps me out because I know I'm probably going to be going over all of the Syringoma once again. So that's how I price that. Now, let's talk a little bit about, everybody wants to know about the numbing cream. What should you use? Okay, so you might be using a great numbing cream out there. There's a lot of them. I use the Neuromed BLT for a few reasons. BLT is something that is, when it's compounded in a container, it's prescriptive. When it comes in packages like you see there, it's not prescriptive. So you can use this because you'll be mixing this yourself. So, and the open containers are frowned upon by health departments, and we all know sometimes you go to a provider and they'll put that tongue depressor in. Well, my clients appreciate if I have to numb, and this is one of the only things maybe I'll do numbing with the Skin Classic is right around the eye there. So I make this a complete setup for my clients so they understand why I may be charging, $25 more for the procedure than if I didn't use numbing. I don't necessarily tell them that, but I embed it into the treatment cost. So, and it does cost about $10 to use, maybe eight, depending on the size. Now, this is a video that you can watch on how I mix it up. I'll just dermabrade the skin just to open the skin a little bit more, apply the cream, and let it sit for up to 20 minutes, sometimes 25. Now, around the eye, I can generally get away with 15 minutes. The skin is very accepting. The thicker the skin, the longer you must wait. In this particular video, I was numbing the back, and the back takes at least 30 minutes and a good microdermabrasion prior to it, or a little cellophane as well on top. So you can watch this video at your leisure on how I use this and use it as a nice clean setup. It's very professional when you do it like this rather than just like slapping it on their skin. So we don't really want to do that. Let me see if there were any questions. How many did we treat? I can't tell about how many there were. Well, Lisa, I know on her, I probably treated at least 25 in all on her. So, um, That would be like a $300 treatment. Can the three creams be purchased over the counter? Yes, we have them on our website. And guess what, you guys? Somebody's going to be lucky today and win a sample pack. We'll have where you can do 5 different treatments with BLT. So if you want in on the sample pack, 5 clients with 5 separate, so you'll get 15 of these packets. Then I want you, beside your name, to put the word BLT. And at the end of the broadcast, I'm going to go ahead and pick a lucky winner and we'll send you your sample size of this. So I'll make sure that I want to see those BLTs coming in, you guys. So, okay, great. Now, this is another thing. You might be watching me on another platform. I have a group, Thermolysis Skincare for Estheticians. If you're watching there, you've got to put your name in because you're only coming up as a Facebook user. If you're on my RN Faces Facebook page, your name will come up. So make sure that you do that. And hey, Georgianne, awesome. Yes, BLT. So here's just yet another way I like to use the Noramed BLT. This was before a microneedling procedure with multi-tryptanic collagen actuation. So you can pop this up too at your leisure. Maybe I'll just give it just a quick little roll, just so you can see how I use my exfoliating wands. I'll actually put the Noramed BLT onto the skin and start to microdermabrade it in. This is my suction free microdermabrasion wand, and they're available in my store as well. So it really helps to kind of grind that BLT in because one of my sayings is time is money. And I don't want to prolong my clients in my chair. They have more important things to do, and I have more clients to see. So it makes it easy that way. Let's see. Let me get you out of there. Okay, so just real quick about Noramid BLT. You're just going to cleanse the skin quickly, and the dosage will just be wherever it is that you want to work. You're not going to work on anything open, and it is pH balanced. So if you got some of this in the eye, and I might use some of this for my permanent eyeliner, it's okay because it won't burn the cornea. There are some topicals that you want to stay away from, like EMLA. EMLA is a great anesthetic and used in the hospital, in the NICUs, and all of that on to do IV insertions. But around the eye, it could burn the cornea. So if you use EMLA, don't use EMLA around the eye. Use it anywhere else. And there's all kinds of different creams. Some people use Zenza. I hear that works pretty good. Also, in the permanent makeup world, it's Numb Quick Pink. All of these tend to work about the same time. 15 to 20 minutes is the approximate time. Some will use an occlusive dressing like saran. And in the medical world, that's kind of frowned upon unless you have the blessing of a physician. And generally, that was because some people overdid it with laser hair removal, putting it on large areas of the body, and using a saran and it seeping into the skin, into the body. So, but these small areas are generally very safe to do. You don't want to use any warm compresses, and you don't want to exceed 10 grams or millimeters per application. So for us, that wouldn't happen anyway, but I'm talking more about the large areas of the body. So it's a very easy product to use and it stays fresh in its container. So you don't want to get caught with an open container. So the single packs are the way to go. They're legal to use if you're not the doctor. And those barrels, those containers are really meant as a one time prescriptive, believe it or not. But people use them, and that's fine with me. But that's why I use the Noramid BLT. Let's see here. So you can look at this video and you'll see that we pre-numbed this nice lady as well with the Noramed BLT during one of my trainings in the Chicago area. And funny enough, this treatment was done hours before I went on live TV with my nurse friend Karen, who has a TV show generally once a month on YouTube. And she invited me to explain everything about the Skin Classic. I performed treatments on TV. It was so much fun. But that was during the same trip a few years ago. But I want to show you the treatment. So you can get the treatment up. And there we are getting ready to work our magic with the Noramed BLT. So you could watch it in its entirety, but we don't have that time. So you might have seen this quick treatment that I posted. Now, that is the nice lady that you just saw. And she is dark complected. This shouldn't affect it. However, immediately after you saw, we get a brown crust. And sometimes people of color might just temporarily become darker. So, but we're using at a low intensity. So it shouldn't be something that will plague our clients as hyperpigmentation or hypopigmentation. But I want to stop it right there for a second. Um, it was during a training, and this was the trainee. She was awesome. Josephine is an awesome Skin Classic provider. But I can tell you when I look back on the video, and because it was her first time at it, I mean, she had great hands. Look, she can really master the skin around the eye. Her client was comfortable. But I think we probably could have slowed down our hand and done it a little bit more slower, methodical, and if you notice when I turn the video back on, you'll see there was a little clump of cells right at the tip, which will impede your electricity. So we might have been shooting some blanks. I wanted to show you this because I'm watching with a hawkful eye during my training, but when I looked at the video, I think I could have done a better job by having her work a little heavier handed. But again, she was brand new. Her confidence was great. And I know I would have had a heavier hand. So she did need a second treatment, which we all know is a must. But at least now she'll know to get back at it, but with a little bit more vim and vigor. So generally, I do these at 25. If I thought I had a good command of the skin and I was methodical and slow, and then they came back with, wow, not much improvement, that's when I might bump it up to the highest level, 30 for the syringoma. Just like flat hyperpigmentation, we might go between 20 and 30, right? 20 to 30. I always work at the low end and generally get the desired outcome. If my syringoma comes back and staring at me again, just like it's got a mind of its own, I'm going to bump it up and work a little slower. Knowing that there was no hyperpigmentation or hypo, I can maybe be a little bit more vigorous. So that might help because I do know that in our group, occasionally that comes up. Um, Angelique, I see your name. You're good. You're good. And Dawn, and yeah, Diana, awesome. Thanks for putting in the BLT and your name. That's awesome and so important. Oh, thanks, National Aesthetic Spa Network. And if for those of you that don't know NASN Pro, it's free to join. You can hop on to here and I'll put a link where you all can join because if you want to see the Skin Classic in action, next month we'll be in Pennsylvania at the Malvern Hotel in Malvern, PA. So let me know if you need that info and I'll get it right over to you. So anyway, there are some of the pitfalls. So And it's happened to me, right? I was conducting this training, so I could have done a better job in making sure that that little piece. And let me see. I'll play that so you can see this again. And if you look close, you'll see we're a little light-handed, and you can see that little piece of dead cells there. But she did get a good outcome after all was said and done, and Josephine got with her. But you can see that. So I just feel like if any of you out there are having difficulty, just try to remember doing it that first time, even if you're a little light-handed, that's okay because you're going to have at them again at another setting a month to 6 weeks later. Then turn up the heat a little bit and slower hand with um, a more determined and slower approach. And let me So I threw in here a few milia treatments too, because we were trying to decide what's the difference between milia and all of that. So here's a quick one. And, these look almost like syringoma, but they were all sebum filled. So we used our F6 for this. And this F6, we actually touched and inserted a tiny bit. You could see it blossom. The sebum becomes warm. And then when the crust forms and the crust falls off, those sebum little balls generally fall right out with it. So this is an awesome way to treat teeny tiny ones, not the larger ones that we just touch with an F12, but this one I actually inserted. And this isn't me. This is during a training with Lindsay in Detroit in Idaho a few years back, and she was treating like a pro as well. Look at that great stretch. She had her client very comfortable. We did not numb this client, and I will tell you, she was a trooper. Um, and when we were done, she was super happy. And they all, as predicted, crusted up, fell off. And she may have had a little touch up work needed. So that touch up day would have only been $25 because she didn't need to do near the amount here. Hey, Kelly Wilds, how are you? So glad to see you and everybody here. That's pretty awesome. Let's see, another way to go about this was a milia that I did for a client and some multi-tryptanic collagen actuation. I kind of pulled out all the stops with this one. I did the skin classic for the milia, some microneedling, and some multi-tryptanic collagen actuation for those deeper lines. So that's what that was, and that was also partial insertion and also just a one touch for some of the smaller ones. So I have video on that as well. Now, sometimes we have a very large milia, so I always like to show this one because we're talking about around the eye. So I get my F12 on 20, I touch, I insert, and then I came out. Then I go back in with my F12 and I widen that pore. I want to open that pore. I can't just touch that and feel like it's going to dry it up. There was way too much sebum. You can see that my client is fairly comfortable and I have to extract that. Now, I use the little hook extractors, and the video makes it look like they're pointing down, but they are pointing up. And I just easily extract. Now, if you notice, my stretching hand or my left hand never really moves. I don't move it around a lot. I don't want my client to tear up too much, so I try to keep that as still as possible without lifting and wiping and lifting and wiping and stretching. I try to keep it right there. So that's a good practice technique that you could use when working around the eye. Try to do that. Try to have a very still stretching hand, and use these two fingers or these two, and always plant and then push away. Don't stretch like this. You want to plant, hold that skin nice and taut, and then push away. And that will give you a nice stretch. Now, she did really, really good with all this. And I got that very last bit out for her. So she was a trooper. Maybe last little bit. There we go. And it has never come back to this day. So sometimes large milia may because there's a little sac, but to date, that one has not. Ooh, okay. So let me come back here. So, for you guys, if you are new to watching me, there's lots of different ways you can find me. I am on TikTok, I'm on LinkedIn, I'm here on Facebook, in my private group, on my page. And so you can find me lots and lots of different ways. Let me just, I want to go to my phone too. I want to go ahead and do the scroll type of pick that I'm going to do today because let me see. Oh, yeah, everybody. Oh, yeah, you've got your BLTs in. Right on. Great, 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 great. Let's see who all's here. Great. Awesome. Okay. Wow, everybody. Thank you all for watching. I do so appreciate it. So, when I do call your name, what you'll simply do is private message me just your name and your address so I can ship it off to my trusty assistant, Jackie, and she'll get this out in the mail to you by tomorrow. Um, and you'll start to be able to use your Neuromed BLT, which is also in my store. So, okay, let's see here. I'm going to scroll. This is kind of like a low tech way to do it. I'm looking away, looking away. Okay, and I have Angelique Keb. All right, Angelique. Awesome. So, Angelique, you're going to get the sample size for 5 treatments for 5 different clients and enough to certainly work around the eye. Make sure that you private message me with your name, address only. So I could just ship that over to Jackie and she'll get these out in the mail to you. And don't forget, guys, I will put the link to this slideshow in the comments so that you can retrieve it if you want to use the pictures, if you want to use the video, you want to create a slideshow to educate your clients, feel free, have at it. Let's get our clients educated and yourselves, and we'll have all of those pesky syringomas gone in no time for at least maybe 9 to a year. So that would be very helpful for our clients. And oh, you're welcome, Nancy. You are welcome. Thank you. Thank you. It was a pleasure to come to you today. I'll see you next Monday with yet another topic, so stay tuned. It's been fun. And if you have any specific questions that maybe I didn't address in this, please put them in the comments and I will get back to you and post those questions as well, because there might be somebody that was asking the same question or thinking about it, but just didn't ask. So I'll see you all later. Thanks for tuning in and thank you. Thank you.